Hello and welcome. My name is Lisa Eggert, and I am a Senior Account Manager at Delta Dental. I work with the retirement system to oversee the dental plan and to handle anything that relates to dental benefits. My goal in the presentation today is to help you better understand your dental plan. We will review the plan changes for 2025, key terms, and your 2025 cost share information. I will also explain how the plan works, including how your provider choice affects your out-of-pocket cost, so you will be able to maximize your dental dollars. Lastly, I will review available resources for your dental plan, including how to contact Delta Dental. Our first topic is the dental plan updates. The retirement system has reviewed the dental plan and is excited to announce that there will be one enhancement that will take effect in the upcoming 2025 plan year. Effective January 1st, 2025, interim caries arresting medicament will be a covered benefit. This medicament is a non-restorative medication used on baby and adult teeth to slow or arrest the progression of small cavities. It is also used as an alternative to traditional fillings for patients with behavioral or cognitive disabilities, or for tooth sensitivity. This medicament will be covered under diagnostic and preventive services, and the cost share for this category of service will be covered later in the presentation. Our second topic is key terms. These terms are important because they will be discussed throughout our presentation. Before we get to the specifics of your dental plan, let's review these key terms. Coinsurance is a fixed percentage of the cost you share with the retirement system. The coinsurance changes based on the type of service that is being provided. Deductible is the amount you pay each year before your retirement system begins to pay. It remains the same in 2025. Annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventive services, basic services, and major services benefits. Orthodontic lifetime maximum is the most that your retirement system dental plan will pay the entire time you're enrolled in the plan for orthodontic services. Coordination of benefits is the way in which claims are paid when there is more than one dental benefits plan. Your retirement system dental plan uses the carve-out method to process coordination claims. Visit deltadentalmi.com/MPSERS or contact Delta Dental for more information if you have more than one dental plan. The next topic is provider options. The type of provider you choose determines how the claim will pay, so it is important to understand the differences between the types of providers. With the retirement system dental plan, you have the freedom to choose any dentist. If you consider all the dentists that are available, you can place them into three categories: Delta Dental PPO, Delta Dental Premier, and non-participating. The retirement system dental plan is designed to offer the maximum benefit with the lowest out-of-pocket expense when you use a Delta Dental PPO dentist. You will save the most money when you seek services from a Delta Dental PPO provider, because all claims, regardless of the type of provider, are reimbursed at the Delta Dental PPO approved amount. This is the reimbursement rate that a Delta Dental PPO provider has agreed to accept. You will likely pay more when you use a Delta Dental Premier or non-participating dentist because their fees are higher than the Delta Dental PPO approved amount. Let's review each of these provider types. Delta Dental PPO providers are the first type of provider that we will review. When a Delta Dental PPO provider joins our network, they agree to accept the Delta Dental PPO approved amount as payment in full. That means you are only responsible for your coinsurance. In addition, as a participating provider, the Delta Dental PPO provider cannot charge you the difference between the submitted amount, which is the amount they would normally receive for services, and the Delta Dental PPO approved amount. In other words, they are not allowed to balance bill you. As part of the provider's participation in our network, we pay the participating provider directly. The retirement system has designed the dental plan to pay the highest level of benefit when you seek services from a Delta Dental PPO provider due to the lower coinsurance amounts. As an additional advantage, there is no deductible for any type of service when services are performed by a Delta Dental PPO provider. Although a Delta Dental Premier provider also participates with the Delta Dental network and offers discounts off their submitted fees, they do not accept the lower Delta Dental PPO approved amounts. So when you seek services from a Delta Dental Premier provider, you pay your coinsurance plus the difference between the Delta Dental PPO and Delta Dental Premier approved amounts. Because the Delta Dental Premier provider is a participating provider, there is no balance billing between the difference of the Delta Dental Premier approved amount and the submitted amount. Once again, as noted with the Delta Dental PPO providers, as a participating provider, we will reimburse the Delta Dental Premier provider directly. Lastly, there is a deductible that applies to basic and major services when seeking services from a Delta Dental Premier provider. The last type of provider is a non-participating provider, which means that the provider does not have a contract with Delta Dental and is not required to offer a discount or follow any of the guidelines that we set for our participating providers. When you go to a non-participating provider, you are ultimately responsible for the dentist's submitted amount. A non-participating provider will likely cost you the most money because you pay your coinsurance plus any additional cost up to the provider's charge. This means that a non-participating provider can balance bill. As noted with the Delta Dental Premier provider, there is a deductible that applies to basic and major services when seeking services from a non-participating provider. When you go to a non-participating provider, you will likely be required to pay the entire cost of the service upfront. Since a non-participating provider is not required to submit a claim, you should ask whether the office will submit the claim on your behalf. To receive your reimbursement from the plan, we need to receive the claim. So if the claim is not submitted by the non-participating provider, you will need to do it. As a side note, our participating providers in the Delta Dental PPO and Delta Dental Premier networks are contractually required to submit claims for their patients. This slide illustrates a quick visual of the three different types of providers and shows a side-by-side comparison. As you can see, within our participating networks, Delta Dental PPO and Delta Dental Premier, the number of locations and the number of unique dentists continues to grow nationwide. With Delta Dental PPO providers, you only pay your coinsurance. There is no balance billing, no deductible on any of the services, and you receive the highest benefit level. With Delta Dental Premier providers, you pay your coinsurance and the difference between Delta Dental PPO and Delta Dental Premier approved amounts. There is no balance billing, and you have a deductible that applies to basic and major services. And lastly, with non-participating providers, you pay your coinsurance and any additional amounts up to the provider's charge. You can be balance billed by the provider, and you have a deductible that applies to basic and major services. Since the type of provider that you choose determines how the claim will be paid, it is important to have a good understanding of the types of providers. I've included some additional notes about providers that you may find helpful. Your dental plan allows for access to participating providers across the United States. So no matter where you live or travel, you can seek dental services from Delta Dental participating providers. If you are out of state, it is important to let your provider know that claims need to be submitted to Delta Dental of Michigan to process and pay, since that is where you have coverage. All providers outside of the United States are considered non-participating providers, but out-of-country claims can be submitted for reimbursement. If you are searching the Delta Dental provider networks, you may notice that sometimes a provider participates in both the Delta Dental PPO and the Delta Dental Premier network. If this is the case, the claim will automatically be processed using the Delta Dental PPO network status when a claim is submitted. This means you will receive a higher benefit level and a deeper discount on the claim cost. Please note that a provider may have a different network status based on office location, so be sure to confirm with the treating office. Feel free to provide a copy of the coverage overview flyer to your provider so they can better understand your dental benefit. Lastly, an office could have both Delta Dental Premier and Delta Dental PPO providers. If you want to see a Delta Dental PPO provider because you will receive a higher level of benefit and deeper discount, let the provider office know that you want to see only the PPO providers based on how your dental plan pays out benefits. Participating status is based on the provider and location, not by the office. The next topic is your 2025 cost share. As noted on this slide, your cost share is a percentage of the approved amount, coinsurance, and any applicable deductible. I mentioned earlier that your coinsurance changes based on the type of service that is provided. The coinsurance is also affected by the type of provider that you are seeing. You will notice two columns on this slide. The first is the Delta Dental PPO dentist, and the second is the Delta Dental Premier and non-participating dentist. As you can see within the diagnostic and preventive services category, there is a lower coinsurance when you seek services from a Delta Dental PPO provider. This means you will have lower out-of-pocket cost. If cleanings and exams are done by a Delta Dental PPO provider, you will only have a 5% coinsurance. If the same services are done by a Delta Dental Premier or non-participating provider, the coinsurance is 10%. The frequency limitations for cleanings and exams are twice within a calendar year. This means that any time between January 1st and December 31st, you can have 2 cleanings and 2 exams completed. If you go to a Delta Dental PPO provider for an X-ray, the coinsurance is 5%. If the same X-ray is done by a Delta Dental Premier or non-participating provider, you will have a 25% coinsurance. The next category of service is basic services. This is where the bulk of your dental procedures fall. Within this category, you will have minor restorative services, which are fillings, major restorative services, which are crowns, periodontic services, which are anything that has to do with your gums, endodontic services, which are root canals, oral surgery services, and relines and repairs to existing dentures and implants. As you can see within the basic services category, fillings have a lower coinsurance when you go to a Delta Dental PPO provider, and the coinsurance is 20%. If you go to a Delta Dental Premier or non-participating provider for fillings, the coinsurance is 25%. All the other services within this category have a 25% coinsurance for Delta Dental PPO, Delta Dental Premier, and non-participating providers. Even though all providers have a 25% coinsurance, you will save the most money when you go to a Delta Dental PPO provider. Later in this presentation, we will review a payment example to see how the type of provider affects how the claim is processed. You will also note that within the basic services category, there is a deductible for services that are performed by a Delta Dental Premier or non-participating provider. This deductible is also applied in the major services category. Major services include prosthodontic services, which are anything to do with replacing missing natural teeth or adding fake teeth. These services can include bridges, dentures, and implants. Within this category, the coinsurance is 50% for all types of providers: Delta Dental PPO, Delta Dental Premier, and non-participating. To reiterate, even though all providers have the same coinsurance amount, you will save the most money and have the lowest out-of-pocket expense if you go to a Delta Dental PPO provider. You will find more detailed information on the dental benefit categories in the Dental Coverage Overview flyer. This flyer can be found on the retirement plan site located at deltadentalmi.com/MPSERS. As noted on an earlier slide, the annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventive services, basic services, and major services, which are the services we discussed on the previous slide. From January 1st to December 31st, every time the plan makes a payment on the service, that amount is deducted from the $1,100. Once the plan has paid $1,100 for services, your annual maximum will be maxed out and no additional services will be paid. You can continue to get services done, but you will pay out of pocket for the cost of those services. It is important to note that if you are seeking services from a Delta Dental PPO or Delta Dental Premier provider, you will continue to receive the discounted amount based on the type of provider, even if you are over your annual maximum or have a non-covered service. It is important to look at your explanation of benefits after a claim has been paid to make sure that the amount you paid your provider for services matches the amount of patient payment on the explanation of benefits. If these amounts are different, you can contact Delta Dental customer service and we will reach out to the office to resolve the discrepancy. Each person covered under your plan has their own annual maximum of $1,100 to use throughout the year. At the end of the year, whether you have used all, some, or none of your $1,100 annual maximum, the slate is wiped clean and everyone starts with a brand new annual maximum on January 1st of each new year. The orthodontic maximum is different because it is a lifetime maximum. This means that the most the retirement system dental plan will pay for orthodontic services during the entire time you're enrolled in the retirement system plan is $1,200. Every time an orthodontic service payment is made, the amount is deducted from the $1,200 orthodontic lifetime maximum. Once the plan has paid $1,200 for orthodontic treatment, there will be no more payment made for orthodontic services. Orthodontic services are only covered for dependents up to age 19. This dental plan also includes an annual deductible. The deductible is the amount you pay each year before your retirement system begins to pay. The deductible only applies to basic and major services when you go to a Delta Dental Premier or non-participating provider. There is no deductible for diagnostic and preventive services for all provider types, and there is no deductible if you seek services from a Delta Dental PPO provider. The deductible is $50 per person per calendar year. Lastly, the retirement system's dental plan has a carve-out clause for coordination of benefits when the plan pays secondary. This carve-out clause affects the way in which claims are paid when there is more than one dental benefits plan. For additional information, please review the How Coordination of Benefits Works flyer at deltadentalmi.com/MPSERS. In this first example, we have a crown, which is also called a major restorative service, and is part of the basic services category. As a reminder, when you have a basic and or major service done by a Delta Dental Premier or non-participating provider, you will have a deductible, and that is shown in the example here. As we begin, you will notice on the left side of the page that we have displayed the three types of providers that were previously discussed. The first provider type is the Delta Dental PPO dentist. As you can see, this Delta Dental PPO dentist charged $1,373 for the crown, but because they participate in the Delta Dental PPO network, they agreed to accept $890 for the service. The PPO approved amount is $890 and is the amount that will be allowed on all claims. Because this provider participates in the Delta Dental PPO network, they cannot balance bill you the difference between the $1,373 charge and the $890 approved amount because there is no balance billing. Since this crown is placed by a Delta Dental PPO provider, there is no deductible. The coinsurance, which is 25% for major restorative services, is applied to the Delta Dental PPO approved amount, So we have 25% of $890, which equals $222.50. Since the Delta Dental PPO provider has agreed to accept the Delta Dental PPO approved amount as payment in full, there is no additional cost when you seek services from a Delta Dental PPO provider. The out-of-pocket cost for a Delta Dental PPO provider in this example is $222.50. The Delta Dental Premier Dentist is shown in the next row. In this case, the Delta Dental Premier Dentist also charged $1,373, but because the participation is in the Delta Dental Premier network, the approved amount is $1,070. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $890. Because this provider participates in the Delta Dental Premier network, they cannot balance bill you the difference between the $1,373 charge and the $1,070 Delta Dental Premier approved amount. If we look at the member cost share, we will see the $50 deductible because this is a Delta Dental Premier provider and it falls into the basic services category. Moving to the coinsurance, we applied the 25% coinsurance to the Delta Dental PPO approved amount, which is the same as the allowed amount. Because a deductible of $50 was paid, we deduct $50 from the Delta Dental PPO approved amount first, so $890 minus $50 is $840. So 25% of $840 is $210 of coinsurance. The additional cost for this Delta Dental Premier provider is the difference between the Delta Dental Premier approved amount of $1,070 and the Delta Dental PPO approved amount of $890 that is paid on this claim. So the additional cost is $180. If you total up all the components of the member cost share, which include deductible, coinsurance, and additional cost, the out-of-pocket for this Delta Dental Premier example is $440. The last row shown is a non-participating provider. In this case, the non-participating provider also charged $1,373, but it's important to note that when members go to a non-participating provider, they are ultimately responsible for the charge. In this case, the non-participating approved amount is $1,373, since that is the amount the non-participating provider will receive at the end of the day. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $890. If we look at the member cost share, we will see that because this is a basic service done by a non-participating provider, there is a deductible of $50. Moving to the coinsurance, we apply the 25% coinsurance to the Delta Dental PPO approved amount. Because a deductible of $50 was paid, we deduct $50 from the Delta Dental PPO approved amount first. So $890 minus $50 is $840. So 25% of $840 is $210 of coinsurance. The additional cost for this non-participating provider is the difference between the non-participating approved amount of $1,373 and the Delta Dental PPO approved amount of $890 that is paid on this claim. The additional cost is $483. If you total up all the components of the member cost share, which includes deductible, coinsurance, and additional cost, the out-of-pocket for this non-participating example is $743. As you can see by this example, even though the coinsurance is the same at 25% for all provider types, the type of provider that you choose determines how the claim will pay and ultimately your out-of-pocket cost. You will save the most money in the retirement system plan if you seek services from a Delta Dental PPO provider. In this next example, we have a cleaning. Since this is a diagnostic and preventive service, there is no deductible for any type of provider. Once again, you will notice on the left side of the page that we have the three types of providers that were previously discussed. We will look at the Delta Dental PPO dentist first. As you can see, this Delta Dental PPO dentist charged $111 for the cleaning. Because the participation is in the Delta Dental PPO network, the provider agrees to accept $71 for the service. This $71 is the PPO approved amount and is the amount that will be allowed on all claims. Because this provider participates in the Delta Dental PPO network, they cannot balance bill you the difference between the $111 charge and the $71 approved amount. There is no deductible because it is a diagnostic and preventive service. The coinsurance, which is 5% for diagnostic and preventive services, is applied to the Delta Dental PPO allowed amount, which is the amount that will be used to calculate payment on all claims. Therefore, 5% of $71 equals $3.55. Since the Delta Dental PPO provider has agreed to accept the Delta Dental PPO approved amount as payment in full, there is no additional cost when you seek services from a Delta Dental PPO provider. The out-of-pocket cost for a Delta Dental PPO provider in this example is $3.55. The Delta Dental Premier Dentist is shown in the second row. In this example, the Delta Dental Premier Dentist also charged $111. Because the participation is in the Delta Dental Premier network, the Delta Dental Premier approved amount is $86. However, the plan will only reimburse the Delta Dental PPO approved amount of $71 on all claims, which is shown in the allowed amount column. Because this provider participates in the Delta Dental Premier network, they cannot balance bill you the difference between the $111 charge and the $86 Delta Dental Premier approved amount. As we look at the member cost share, we see that there is no deductible because this is a diagnostic and preventive service. Moving to coinsurance, we apply the 10% coinsurance to the allowed amount. So 10% of $71 is $7.10. The additional cost for this Delta Dental Premier provider is the difference between the Delta Dental Premier approved amount of $86 and the Delta Dental PPO approved amount of $71 that is paid on this claim. So the additional cost is $15. If you total up all the components of the member cost share for this example, it includes only the coinsurance and the additional cost because the deductible is waived for preventive services. The out-of-pocket cost for this Delta Dental Premier example is $22.10. The last row shown is a non-participating provider. In this case, the non-participating provider also charged $111. It is important to note that when members go to a non-participating provider, they are ultimately responsible for the entire charge. In this case, the non-participating approved amount is $111, since that is the amount the non-participating provider will receive once all payments are made. However, the plan will only reimburse the Delta Dental PPO approved amount of $71 on all claims, which is shown in the allowed amount column. As we look at the member cost share, you will note that there is no deductible because this is a diagnostic and preventive service. Moving to coinsurance, we apply the 10% coinsurance to the allowed amount, so 10% of $71 is $7.10. The additional cost for this non-participating provider is the difference between the non-participating approved amount of $111 and the Delta Dental PPO approved amount of $71 that is paid on this claim. So the additional cost is $40. If you total up the applicable member cost share components for this example, it includes only coinsurance and the additional cost because the deductible is waived for preventive services. The out-of-pocket cost for this non-participating example is $47.10. In this example, we saw that members receive a higher level of benefit when seeking services from a Delta Dental PPO provider because there was a 5% coinsurance versus the 10% coinsurance for Delta Dental Premier and non-participating providers. Your out-of-pocket cost will be determined by the type of provider that you choose. You will save the most money in the retirement system plan if you seek services from a Delta Dental PPO provider. Members often ask if there is a way to receive an estimate for services that are needed. The answer is yes. You need to request a pre-treatment estimate. When a pre-treatment estimate is submitted to Delta Dental by your provider, it will provide information about how the dental plan will cover the service and your out-of-pocket cost. This information is helpful as it may lead to further discussion of treatment options with your provider. Let your provider know that you want the pre-estimate submitted to Delta Dental. When this pre-treatment estimate is submitted to Delta Dental, the estimate runs through the claims processing system as if it were being processed and paid. It will provide information on the current annual maximum available, whether the service is denied due to time limitations, and whether the service is covered by your retirement system dental plan. You will know that this has been completed because a copy of the estimate will be provided to both you and your provider. Please remember that the pre-treatment estimate is subject to the amount of your annual maximum available at the point in time that the request is received. If you have additional services done after the estimate, it may affect the payment amounts for the procedure that was sent for the pre-estimate. The last topic to cover is helpful resources. To provide materials and information that are specific to the retirement system dental plan, we have a designated extranet site for the retirement system. The link for this site is located on the Michigan Office of Retirement Services website or can be accessed directly at deltadentalmi.com/MPSERS. On this site, you will be able to access specific information about your retirement system dental plan and written plan documentation. View this presentation, search the dentist directory for a provider, and link to the member portal. The Delta Dental member portal allows you to access your specific dental plan information once you have created an account. Once you have logged into the member portal, you will be able to view the members covered on your plan, find an in-network dentist, see information on common procedures, view and print specific explanation of benefits, check your annual maximum used to date, access and print an online ID card, and view the status of all claims. The member portal website can be viewed on all device types. The best way to find a provider is to access the provider directories online, which has the most up-to-date information available. If you are not comfortable using the online directory, you always have the option to call customer service and request a listing of providers near a certain address or zip code. The next couple of slides will provide information on how to do a dentist search online. You can access the dentist search feature on the Delta Dental corporate website or on the extranet site that is specific to the retirement system. The Find a Delta Dental Participating Dentist flyer at deltadentalmi.com/MPSERS provides step-by-step instructions on how to search for a provider. Once you have made the selection to find a dentist and search for a Delta Dental PPO and Delta Dental Premier provider, you will see a screen as shown. In the first box labeled Specialty, you can search for a specific specialty or search any specialty, which will include all results from all provider types. In the second drop-down box, you can choose the network to search. I would recommend that you search the Delta Dental PPO network first, as providers in that network will save you the most money. You can also choose to search the Delta Dental Premier network to see what options are available. If you are looking for a specific dentist and have the dentist's last name, you can include that in the search criteria. You may also leave it blank. If you select Y for search by current location, the search will use your current location. If you select N for search by current location, an additional field will pop up for zip code, city, or address. Once you have input the requested information, select the green box labeled Find Dentist. As you select Find Dentist, a new screen will appear with your search results. The search results will display the closest provider to your location if you provide a physical address. You will be able to scroll through the participating provider results. In addition, once you have the initial results, you have more options to change the search or add additional criteria. You will be able to change the specialty and network in the first two boxes. You can also set the distance, radius, and search for providers from a specific address. Providing an address will give you the best information as it will list the providers closest to your location moving outwards. If you select the down arrow for more options, you will have access to additional fields to add a provider's last name, office name, and select specific criteria about hours, language, gender, and whether the office is accepting new patients. If you want to save your results, you can select the Add All to My List checkbox or select specific providers that you want to save. Once you have selected the results that you want to save, click on the down arrow next to My List, which is shown on the top right side of the page. Within this selection, you can choose PDF, print, or email. Remember, if you see that a provider participates in both Delta Dental PPO and Delta Dental Premier, the claim will automatically process and pay using the Delta Dental PPO network status, which will save you the most money. Delta Dental has a smartphone app that is available for Apple iOS and Android users. To access the app, you need to create a member account. If you have already created a member portal account, the username and password is the same for the phone app. This phone app will allow you to access the cost estimator, view benefits, find a dentist, view claims, and view your mobile ID card. As a reminder, because the member portal has been designed to be viewed on all devices, the member portal features are available at your fingertips as well. There is a link between oral and overall health. So this is a reminder to be wise about your oral health. Maintain a regular oral health routine. Older teeth are more susceptible to decay, especially around old fillings and the gum line. You should brush twice daily, floss at least once daily, and visit your dentist for regular cleanings and exams. Take care of your dentures. If you have dentures, your dentures will fit better and last longer if you take proper care of them. You should brush your dentures at least daily, remove and rinse them after eating, soak them overnight, and rinse them before putting them back in your mouth. Understand your risks. Medications and medical conditions can affect your oral health. More than 400 medications can cause dry mouth, which prevents saliva from protecting your mouth against bacteria and decay. Furthermore, those who suffer from Alzheimer's disease may forget how to brush their teeth, and people who have osteoporosis may notice loose teeth from decreased bone density. Watch out for gum disease. Untreated gum disease causes damage to the gums and jawbone, which can lead to receding gums, loose teeth, and even tooth loss. Gum disease is linked to other health issues like heart disease, diabetes, and respiratory problems. Poor dental hygiene, tobacco use, bad diet choices, and medical conditions can increase the severity of gum disease and can be detected in the dental chair. As we wrap up this presentation, if you have additional questions about your dental plan, you can contact the Delta Dental Customer Service Department toll-free at 800-345-8756. Our advisors are available 8:30 a.m. to 8 p.m. Eastern Standard Time, Monday through Friday. We also have an automated system that is available 24 hours a day, 7 days a week. The automated system provides benefit, claims, and eligibility information, the Delta Dental mailing address, and names of Delta Dental PPO and Delta Dental Premier dentists near you. As a reminder, you can also access plan information and additional resources on the extranet site for the retirement system at deltadentalmi.com/MPSERS. Thank you for taking the time to review the information about your dental plan. I hope that the information provided will be helpful to you in maximizing your dental plan and minimizing your out-of-pocket cost. Have a great rest of your day.